Hey everyone, welcome back to my channel, and if you are new here, I am Mariana and I interview the brightest minds of physical therapy. So if you want to increase your knowledge, start right now by subscribing to this channel, clicking on the bell so you don't miss anything, give us a thumbs up and share with your friends. Today, our guest is Dr. Heidi Jannenga, and she will talk about top trends impacting rehab therapy. Heidi is the co-founder and chief clinical officer of 𝐓𝐻𝐵T, a market-leading software solution for outpatient physical, occupational, and speech therapists. Heidi also recently launched Rising Tide, which is a foundation dedicated to fostering diversity and inclusiveness in physical therapy workforce. I hope you enjoy the show. PT Pro Talk podcast is only possible with the support of the forward-looking and innovative company Rangemaster, the most trusted brand for shoulder therapy tools. Available now on Amazon. Hi Heidi, welcome to PT Pro Talk. How are you today?
I'm very well, thank you, Mariana. It's great to be here.
It's my pleasure to have you here. I'm a super fan, so let's jump right in. Can you share a little bit about your background story and 𝐓𝐻𝐵T story?
Sure. I have been a physical therapist going on 25 years now. I specialized in sports medicine and outpatient orthopedics. I went to the Institute of Physical Therapy, which is now called the University of 𝐏𝐸𝐺𝐷𝐸, and was manual therapy certified as a physical therapist. And after about 15 years of practicing, I sort of moved up the ranks into leadership roles and became a clinic director of one of the larger sports medicine practices in the country, which was located here in Tempe, Arizona. And as a clinic director, you have P&L responsibilities. And so one of our biggest expenses was transcription and dictation. And you have to take yourself back to, 2006. I know, you're younger, you have that sort of digital sort of aspect and knowledge. But back then we were all documenting on pen and paper. And so all of our notes and things that went to our physicians had to be transcribed and dictated. Or dictated and then transcribed. And so in trying to solve for that problem, we went and searched what electronic medical records were out there for physical therapists, and there were only a few. They were all server-based, so you had to have a computer that you put a floppy disk in, and you could only work off of that computer. I know it seems so silly. Like, it's progressed so much in the last 15, just in a very short period of time. And so essentially we were like, none of this is going to actually fit with a PT's workflow. And so I put my head together with a software engineer who had a lot of experience in building web-based enterprise applications. And so we built something that was originally supposed to be for my practice. We had version 1, and we started using that for about 6 or 7 months. And then some of my friends in the area said, "Hey, we want to try this." And before we knew it, we had 12 clinics up and running. And that's when we really discovered, that the problem that I was having in my practice really was a same problem that many, many, many therapists, 80% of therapists to be exact, were having across the US. And so in February of 2008, we launched the company with 2 employees. And we sold 5 clinics that very first month. And today, we have close to 800, a little over 800 employees all over the nation. We have amazing 𝐓𝐵Ters all over the U.S. And we have just now, with our last acquisition, just over 50% market share.
That's awesome. I love the story. And it's so crazy to think that a couple years ago, everything was so different. And it's already so hard to document everything on the electronic system. I just can't imagine having to do all of that in pen and paper. It must be so hard.
Well, there's been a lot of, things that have, helped us to grow as an organization. As an entrepreneur, you solve a problem, we solve that documentation problem. But as we've continued to, be the market leader, part of that is because of all the changes in regulatory requirements. And so unfortunately, the administrative burden to us as therapists in our documentation requirements has continued to grow over that same period of time. And so our big goal has always been to try to help offset that through technology and automation efficiency to help, therapists get back to we no one goes to PT school to want to document, and that's
No.
the worst thing you learn in PT school, right? Everyone hates it. They want to treat patients and we want to get our hands on people. And
Yeah,
so
that's our nightmare.
yes, that's the bane of our existence. It's like the have to do portion of, our therapy lives. And so we want to make that as easy as possible.
Yes, absolutely. And how we evolve on these last couple years is just crazy. Um, and and now you, as a leader of in PT and technology, what do you see that are the top trends impacting rehab therapy?
Yeah, there's a lot of things that are sort of impacting our trajectory. Obviously, there's been a consistent sort of decline in our revenue or our pay per visit, and so you know trying to figure out alternative ways to generate revenue or to get more patients in the door, right? And with that, unfortunately, that's been a struggle for us because we've talked about this for a long time, and there's a lot of folks in the industry still talking about this too. It's just the brand of PT and how unfortunately we haven't done a good job of really broadcasting that brand and our value that we provide in the overall healthcare continuum. And so I think the trend of really emphasizing and helping to unify our language around what we do as therapists to the general public, how do we better communicate that brand to others, I think is definitely something I really feel like there's a lot more people circulating and coming together to understand that this is a big issue that we need to solve. Over the last couple of years, with the pandemic and people going home, and it's the rise of virtual visits and telehealth is definitely something that we're gonna continue to need to figure out how physical therapy fits into that world. Personally, I think it's going to be the hybrid model that wins out. Uh, I don't think there's anything. Our secret sauce is about what we do with our hands and how we put our hands on patients. But that doesn't have to mean that happens every visit. Our other part of what we do is exercise instruction and posture and behavioral change, and those types of things don't always have to be done face to face. And so, how do we evolve our practice into maybe this more virtual model? Which again, we have to meet our patients, our customers, where they are, and a lot has changed in the last couple of years, and people aren't their ways that they maneuver through the world today is a lot different, and a lot of it now has to do with this through a computer. Um,
Yes.
and we're seeing a lot of competitive pressure in this area. There's quite a few large organizations and companies, tech companies, that are now coming into our space that are all virtual. So private equity knows that what we do is very beneficial, but it's how do you deliver that service in a way that people are willing to consume it and willing to take it, and maximize the value. And of course, insurance companies always want to maximize the cost, right? To minimize the cost, I should say. So those are some of the big things. I mean, from internal, we like many other industries are dealing with burnout. We were essential workers, so we are essential workers through this time, and it's been a tough road of change, and how we actually the visit numbers going up and down, people changing jobs. Like there's a lot of different things going on with regard to burnout. But I still think, we are still one of the number one healthcare providers in terms of people wanting to be a physical therapist. So I think that um, we're going to survive through all of this. And something I'm really personally invested in is as we think about the future of PT, is really diversifying our workforce and really helping to improve and mirror more of the population to hopefully be able to overcome and attack what we call the 90% problem, right? I'm sure you've heard of it, but so many more people are now starting to recognize that we're fighting over the same 10% of the US population that understands the value of PT and gets in to see us. So 90% of those people who have been diagnosed with an MSK diagnosis are not getting into PT. They're going elsewhere. And we need to really move the needle on getting more of those folks into PT. And so figuring out ways to do that, I think, are definitely big trends that we're going to see in the next few years.
Yeah, so now it's my questions about everything you said. So how do you think that we can change the general public vision and idea about physical therapy? Because I think that is something, I agree with you, that still many people have no idea what it is. And I mean, it's something that most people are gonna need at some point in their lives, and it's still a big number of people that have no idea. So how do you think we can change that?
Well, first and foremost, I think we have to come together as an industry, despite our specialties, to coalesce around a common message that is easily understood by the general public, whether that's the movement specialist or MSK, which now seems to be much more of a layman's term. Uh, so really coming together to formulate what do we do and serve that up in a way that people can really understand and connect with. As an example, chiropractors have done this so well, right? If anyone thinks about low back pain, the general public, what is their first response? Oh, I need to see
Chiropractors.
a
Yeah.
chiropractor, right? And
Yeah.
so there's that association that's been made. I mean, that's just classic marketing. And so we need to figure out how we can do that as well with what we do. And the hard part for us is that we do so much, right? There's so many different value props that we deliver, whether it's from the cradle to grave, right? It's all in between. We have specialties to help there, and so it's rising above that a little bit and finding out that simple message of what do we do. I think is the first and foremost piece of it, and then the other part of it, I think, is really stepping up and utilizing our DPT. We fought really hard to get that doctorate level professional licensure and distinction. And so with that DPT, like we need to step up as primary care providers for MSK and deliver on that. So that's I think part of the second piece, and then I think there's a lot more people talking about this brand issue, and so it doesn't come easy. It takes dollars, right? And it takes organized plan to deliver that message. And so I think more and more, either large organizations, along with the APTA, along with APTQI, like there's a lot more folks that are really starting to come together and collaborate on how do we get this message out there. And of course that takes financial backing as well, which these types of organizations can do.
And I think PT is so broad that's really hard to convey one idea because you have so many different specialties. And it's already hard to the orthopedic, that's I think the basic one that everybody think about at first. It's hard for people to realize exactly what it is. I just imagine like all the other specialties, people have no idea about pelvic health, for example, and many others. So I think it's something that's gonna take some time to happen, but I do agree with you that it's something that's super important. And then after the traditional PT, then comes telehealth. So I've been doing a lot of telehealth, and it's so hard to explain to the public what is telehealth and how can you do physical therapy virtually. They don't have the initial idea of traditional PT, and then you talk about telehealth, then it's like it's really really hard. So as you were saying about the hybrid model and this new trend that's coming, I think it's gonna be hard too to get clients to do telehealth and understand that can be really effective as well. So I think
Well, the
that's another
unfortunate part
big.
is that we did show that, right? We when we had to through the pandemic, there were a significant number, over 50% of our visits in Web PT during the height of the pandemic were done virtually. So we did figure it out. But now that we can start, and patients started coming back into the clinics, and it was safer, that number now has gone way down. And part of that is just human nature. You go back to knowing what you know best, and it's kind of that habit of how you do things, right? But we learned a lot of things through that period, and most importantly, patients learned a lot of things,
Mm-hmm.
right? The
Yep.
unfortunate part is we just had to wing it. Like there was no education, there was no, we're kind of learning in flight, right? And so as we continue to evolve and education continues to evolve, and we take what we learned during that last 18 months of what works, what doesn't work, and with this competitive pressure, patients are going to understand and look and ask for the opportunity to not have to, drive or how, especially from if we're trying to have more access to more people, right? Rural areas and places that don't have true brick and mortar PT offices. This is going to really open up some opportunities to hopefully get PT out there more and deliver, our skill set to more people. So it's really taking what we learned, but also for us as an industry to evolve and embrace change. And we all know change is not easy, but we've experienced it. We've done it. We did it really well. How do we now take what we learned and translate that into the future of how we do business and how we actually deliver our care to those patients who need us?
Yeah, and I think my experience is the clients that they were open to try telehealth, they really enjoyed, they really liked it, they were really compliant and saw good results. But a lot of them are very resistant and they don't want to try. So the ones that are open, I think it works good. But the ones that don't want, there is no way of convincing them that it's possible to be done and have good results. So I think that's going to
Yeah.
be a
Well,
challenge.
we know just like anything else, there's an adoption curve, right? So
Yeah.
right now we're still in those early adopting phase. And part of it also is just a technology barrier. But I think more and more that is going by the wayside. Pretty much everyone now has at least a cell phone with internet access. There's still quite, a percentage of people that don't. So, it's not going to be necessarily for everyone. Um, but for the majority of people, they're becoming much more savvy, especially even those over 60, 65, who in the past were not as technology savvy, but with having to do Facebook or FaceTime with your families and things like that, there's been a lot more advancement in technology savviness through all ages, I think.
Absolutely. And then What do you think that should PTs be thinking about in terms of strengthening their practices? What do we need to do individually and collectively?
Yeah, so we saw, you know, the threshold be pushed as far as business resiliency through this last couple years. We at WebPT really emphasize a lot of understanding around how to run a business and what things to think about, and you know, um, business planning, budgeting, disaster recovery. All of that is something that has to really be understood as you go through business. And unfortunately, as revenues waned, visits declined. There were for quite a few months. Unfortunately, there were quite a few practices that didn't make it through this pandemic, and so there are clinics that are there, or therapist owners who are reevaluating, whether or not they want to continue with the difficulty, as we talked about earlier, in terms of the regulatory compliance, the administrative burden, all of that. Sometimes it's easier to say, I'm going to sell my practice. Plus, there's consolidation happening in the market, right? There's a lot of opportunity for smaller practice to either give up a percentage of their company to sell to a large organization, where they have administrative assistants there, things like that. So there's just a lot of change and opportunity depending on which way you go. But for the majority of practices, this viability and financial resilience is something that they've really had to focus on. So um, building tools and best practices around how you continue to engage and stay engaged with your patients, even though, and bring them back into the fold, right? How do you, market now when maybe your physicians are even more than before a little standoffish in terms of having additional folks come in to their practices to shadow, or to do your marketing visits, things like that. And then in general, just how do I make my operations and in my practice more efficient, whether it's from the billing side of the house, or the front office? Like, what are areas that I should be focusing on? We talked a lot about during this time. There were a lot of clinics that were able to finally take some time to work on on their business, right? To look at from a high level on all of these business practices versus working all the time in their business, right? Because a lot of people who are clinic owners are also clinic operators. So they are seeing patients as well as running the business. And so not having the patient side for a little while was allowed them to really pick their head up and say, okay, like, how do I do some of the things that are going to truly make me more efficient, uh, and potentially even a better place to work for my employees? Because we know that that's an issue too. Like, people have choices of where they want to work these days, and got to step up your game as a clinic director or as a clinic owner.
And I think, as you mentioned before, find different uh, revenues streams in your clinic. So when something happens, like happened last year, last 2 years, I don't even know anymore. It's been so long. Have other revenue coming, so they don't depend as much on the in-person visit, right?
Yeah, we've seen that a lot actually, as an evolution of practices who, their payer mix, right, in all the different areas that you generate revenue through a practice. We've seen quite a bit of change there, especially on the cash-based services side, where they're offering more professional services, even to the point of employing massage therapists, or athletic or personal trainers, even some that are actually employing physicians in their greater practice to broaden sort of the opportunity for bring more patients in, but also as revenue streams. And so it's really exciting to see these practices sort of opening up or expanding the box, if you will, of the opportunities that we have as physical therapists to not only generate revenue, but for sure to advance the ability to put our value first as not only musculoskeletal experts, but also, again, as the primary care provider for MSK, but also as refers to others, right? And to engage in more collaborative care holistically for the patient.
And how do you think we can become the PCPs for MSK? Because I think it's also related with the brand, the problem with the branding, because if you have more direct care, it's easier to kind of cut the way from the PCP to the PT. But it's also a problem that people don't even know that they can go, depending on the state, on the laws, that they can go straight to the PT. So I think they're both connected. So how do you think we can become the MSK go-to for the patients, clients?
Well, you are spot on. In the first and foremost, we have to embrace direct access. We do have the ability to see patients as the first line of defense. They can walk in any practice in any part of the country and get seen by a physical therapist for at least that one visit. And we're not embracing that. There's even to this day in my state, in Arizona, we're one of the states that have had direct access for the longest. And I could still call up a handful of PT practices here where the first thing they're going to say is, well, what insurance do you have? And or have you seen a physician? And do you have a script? And if I say I don't have a script, they're going to say, oh, I'm sorry, you have to go to see your doctor first. And it's infuriating because we're not, again, practicing to the level of our licensure, practicing the level of our education, and we're doing a disservice to the patient, right? So really embracing that, I think, is the first thing that we have to gain the confidence to really be able to say yes, and feel confident that we have the tools in our education and to be able to see that first patient, and to recognize that also puts us in such a larger leadership role in the overall healthcare continuum. We now become referrers to primary care doctors or orthopods, right? After we engage in evaluation of our patient, and through all of our special tests and training, we have a lot of understanding. We should know exactly what's going on and create diagnoses for these patients to then be able to, if they need other diagnostics, or special tests, that perhaps we then are able to get them into another provider who can do those services. I will also say it's all about advocacy and continuing to push for more opportunities for us to be a first line provider. For example, in diagnostic ultrasound, for example, we are definitely very qualified to be a provider who truly understands MSK, right? And so with some additional training to become certified in diagnostic ultrasound, this is an avenue that people can A, generate more revenue, but also B, become diagnosticians for more MSK. Like, this broadens our ability to be better providers for our patients. And so advocacy on different areas of adding more tools to our arsenal that we have. And also with insurance companies to make sure that they are recognizing that direct access component and paying us for those services. Majority of insurances today follow the Medicare rules in terms of being able to, and some are even more than Medicare, that will pay for those direct access visits. companies like United Healthcare are actually pushing that direct access because they understand the downstream costs that are being saved by getting you into PT first. There's a huge push right now for physical therapy practices to actually look at your own benefit packages, negotiate on behalf of your clinic to make sure you have physical therapy first benefits in your own practices for your employees, for your people that are within your organization. Practice what you preach, right?
Yeah.
So
Yes.
fight for, and advocate on behalf of yourself and behalf of our profession. That at the end of the day, we have to sort of walk the walk and talk the talk.
And what do you think that these PTs, they are still not doing the direct access like you mentioned before? Do you think it's like a confident issue? Do you think people just don't know about it, or both? Or
I think it's probably a mixed bag. I think there's some people that are fearful of the liability issue. If I miss something, I was the first line of defense. They're going to come sue me. I think that there's some misinformation out there with regard to payment. They're afraid that they won't get paid for that visit. And so, yeah, and then, I think there's some out there that, have just the confidence level that this is the way I've always done it. I have my relationships with my referring physicians. They send me patients and I'm good with that. Right. Because it does take a different sort of thought process and also a change in your marketing process to now move from just marketing to your referring physicians to now actually creating a whole sort of side of marketing that is what we call B2C or business to consumer. How do you, create an audience to allow people and let people know, because this is a twofold problem. Not only do us as clinicians maybe not understand truly direct access, if we don't even understand it, how do our patients?
how are you going to explain it to the patient?
How do you explain it to the patient? But they have no idea, right? And
Yeah.
so it's kind of a twofold thing. But if you truly embrace it, that's how you really have to then push the marketing on the value and how you can come in to see me. Please come in to see me, even if it's for just that one visit that's allowed in my state based on my licensure.
Yes, absolutely. And once the patients start having that experience, they're gonna share, and then more people wanna want it, because why not? It's just easier. Just go straight to the PT, quicker, easier, right? That's what we hope. And when you were talking about the ultrasound, I was just thinking about like the advanced practice that they have in Canada, for example, that they can do those type of things.
Yes. Well, we have it here in the States too, in military PTs. They have so much more autonomy. They can get X-rays done on a patient. They can actually even prescribe, non-steroidal anti-inflammatories for patients. So there's a lot of autonomy in different subset of us as physical therapists. And so it's been proven, again, that we're capable of doing these types of things. It's really just more broadly throughout private practice and also different hospital settings, right? I mean, acute care, there's this hierarchy that sort of has to happen. But when we're talking about direct access, it's really in the outpatient sector.
Yeah, and I had no idea about that, the difference in other settings, I would say, or that's amazing. And that could expand to all the other practices in the country, right?
Yeah, I hope so.
And you mentioned about the insurance, they not wanting to pay for direct access. So where do you see that going? Because I know that the revenue is going down, is becoming harder. So where do you see this going in the future with the insurance reimbursement?
Yeah. Well, let's talk about the direct access first, because again, what's really now changing is decisions are being made based on actual data, not anecdotal evidence. And so as insurance companies have the most data because they have all the claims information, we are starting to get more savvy in this area as an industry because of the use of tools like WebPT and other EHRs, in which you're able to extract information and understanding what's the cost of care for an episode of care, for example, utilization of visits, how many visits does it take to get an outcome. But we're still not also embracing that as a profession either. The majority of practices, unfortunately, are still not consistently utilizing patient outcomes on their patients from initial eval all the way through discharge. We also know that we have a dropout rate, unfortunately, of patients who never actually complete their whole episodes of care. And so there's a lot of factors that minimize the true data set that we can see. But from what we do have, we're starting to be able to use that data for advocacy on our behalf. And also, insurance companies make the claims data public. And so there's lots of studies that are using that claims data to help support the value of what we do. And one of those big things is minimizing the downstream cost, minimizing the numbers of surgeries, for example, that have to be done with patients. And so that is why, insurance companies like United Healthcare, for example, are pushing more of this PT first. It's why employer-based healthcare is really pushing to have this PT first programs, these PT first programs started, to where if you have an injury on the job, we also know the faster you can see a PT post-injury, the faster you recover, right? And also it costs less, you're out of work less time. Like all of these cost benefits are there when a physical therapist is involved as a PT first, especially anything MSK. We're always talking MSK here, MSK injuries. So again, the data supports it. We're starting to see more and more of it, but we just have to embrace it and just go on head on as physical therapists to do it. And right now we're just like most healthcare providers, unfortunately, we're slow to change, right? And you're starting to see the snowball start to form. I think we're going to be pushed harder because of these competitive tech platforms that are starting to come in and talk about how PT can be done 100% virtual. So we're going to have, like I said earlier, some competitive pressure in that area. I don't think that PT visits we're not going to all of a sudden get paid a lot more for our visits. We've had this price pressure for a long time. There's so many variables of why that happens, but one of the biggest is because we don't have outcomes, so they have no idea what they're paying for. There's so much variability in care. So I can go to Clinic A for the same diagnosis that I go to Clinic B, but I'm going to see a therapist with a completely different protocol and treatment plan with 10 visits in Clinic A with, I don't know, maybe an outcome, maybe not an outcome, I don't know. And then Clinic B, I only go for 6 visits and they give me, and I know from that clinic because they do outcomes, that I'm now at 90% of where I was, or of my functional outcome of where I want to be, right? And so there's just variation in care. There's no standards of care that we have in our profession today. And I think going back to the trends, that is one of the trends that is going to happen. We need some more specific metrics and outcomes measures that are going to start to be more mandated at a level in order to get paid. So those that are truly performing, and whether there's variable of care, whether or not you're a McKinsey or exercise-based PT, I don't know that that's really going to matter, but it is going to matter on your outcomes, right? And the efficacy of your care. And so I can see that coming fairly quickly because of the nature of data that is now being utilized, and also now starting to be demanded in many areas. So sorry, that was a long-winded answer to your question.
It makes total sense, because how you're gonna fight for something if you don't have a way to show and prove? So I think the first thing is track outcomes, track data, and I think we don't do a good job overall in tracking outcome and trying to standardize something so we can show what we do, we can show the results, and then we can go fight for something when you have something concrete to show and prove, right?
Right.
I think that's the super important. And we know that another problem that you mentioned before is burnout. So how is the burnout affecting the industry?
Well, unfortunately, we're seeing some of our best and brightest leave the industry, just like a lot of other industries. Personally, I know that we need clinical care, but I just from having lived it myself of leaving patient care and starting a technology company and seeing the impact that I've been able to have on our industry, but also again expanding that brand of PT far and wide outside of the usual sort of boundaries. That I don't think it's a bad thing that physical therapists are looking at other avenues in healthcare or even outside of healthcare, as long as they continue to represent themselves as physical therapists. And that's part of the whole, brand of how the awesome professionals that we have within our industry. Personally, we've hired at WebPT quite a few amazing physical therapists who had great careers, or they were only 1 or 2 years out, and they said, "You know what? I want to impact my industry in a different way. That I just don't see myself being a hands-on clinician. I want to use my clinical knowledge in a different way to actually give back or benefit potential patients or even my peers as providers within WebPT in technology jobs. The more we have representation in other areas like hospital administrators as PTs, even in the political arena, people working at CMS who are physical therapists. Like we really lack a lot of representation because there's been such a dearth of healthcare providers and the mindset going through PT school is that you're going to come out and be a clinician. You're going to be the best clinician you can. And while that's all wonderful and great, and I think that, we need the best clinicians out there, or else, again, that value wanes, right? If you're not actually having great people deliver the physical therapy care. But I do think it's an opportunity to expand the visibility of the great therapists and professionals that we have in this industry. So we're losing some talent, right? Clinical care talent. But I don't always, like I said, I don't think that's necessarily 100% a bad thing. But we do an industry report every year called the State of Industry Report. And last year, the results showed that nearly 50% of all rehab therapy professionals feel more burnt out today than they did pre-COVID. Pretty indicative. It's not unique to us as healthcare providers, right? Your personal life definitely bleeds over into your professional life. And we know all of the factors that, having to deal with kids at home and juggling, being sick, not sick, family members, if you have, older family members who you're feeling very stressed out about, maybe even lost, members of your family or your friend group. I mean, it's been a really tough few years. And so, it's how that's affecting practices. We know we're seeing wage pressure, just like many other industries where, um, unfortunately, though, that's really hard because revenues, again, this all comes back to the business side, right? You top revenue coming in, it's hard to pay your employees more when you don't have more revenue coming in. We have the student debt issue, which is one of the biggest factors to burnout. The cost of our education is not commensurate with what our salaries are within our industry. It takes a very, very long time for people to pay off their student debt. And so one of the ways that it's affecting, though, these are pressures that we feel in our industry. There are people that are now coming out and trying to solve those in different ways. By challenging and changing our educational system, in trying to develop new programs that shorten the time frame in which you're in PT school, which lowers your cost of education, and also different technology, ways to improve your workflows within practices, like we talked about before, so that you're not having to do as much of that administrative component, and therapists who want to get back into clinical, who are doing clinical care, really focus on that patient and provider interaction more than they have to do with the actual administrative work. So it's being attacked in many different ways, but it is something that we have to keep an eye on, because we definitely don't want to lose. We want to keep having the inflow of therapists coming into our profession, who are have that servant's heart of wanting to really make a difference in people's lives, and not lose that opportunity.
Yes, and I think as long as the PTs are helping the profession to grow in different ways, it's all valid and all good. We need people in all areas, not just the clinical care. So I think that's important too. And another problem of our PT area is the diversity, right? So I know I was researching and I saw that you launched a new project, Rising Tide. Is that
Mhm.
right?
It is. Thank you.
So
Very proud.
it's very, yeah, yes. I was just reading about it. It's amazing. So let's talk a little bit about what is the state of diversity in PT.
Well, again, that state of rehab therapy industry report showed that of the respondents, and I think we had close to 7,000 respondents to our survey, and this sort of mirrored the demographic breakdown of our industry, that the APTA puts out. That there was a mere 2.8% that self-identified as Black or African American, and when you compare that to the population of the U.S., there's 12.5% of U.S. population is Black or African American. And then if you look at Hispanic or Latino, the Latinx is only 5.2% versus close to 20% of the U.S. population. And so when we look at providers that are in practices treating, this sort of, and we know that BIPOC populations like to come in to see someone that looks like them. They want to identify with their providers, and if you don't see anyone in the clinic that even remotely looks like you, the fear factor, or the trust factor perhaps isn't there. And so, we've talked about this diversity issue for a really long time. It's come up in every survey that we've done for the 5 years we've done it. APTA has had goals around this, but it just really, we haven't seen hardly any change. As I dug into the problem more, a lot of it has to do with the entry into, there's so many barriers of entry into our profession as far as students go. And even the education piece is one of the biggest barriers. And so, and that in being cost. And then the second one, well, actually the cost of care or the cost of education, and then also just the stress of the student debt. And there really isn't a whole lot of scholarship or um, opportunities for these minorities to actually offset that cost of education. And so when I looked at all of these, it's kept coming back to these problems. And so I had started a foundation called Rising Tide. It's based on the big mantra that I've said for a long time, the JFK quote of "Rising tides raises all boats." And I decided that that was going to be the purpose of my foundation. It's really and it's a scholarship program targeting BIPOC students who want to become physical therapists. We provide scholarships up to $17,000 that can be renewed annually for the 3 years of PT school. To help offset the cost. And then also for residency programs, we offer $10,000 for BIPOC students who want to go on to residency programs. And so we just completed our first cohort of our Rising Tide Scholars. It's our CREST scholarship, which is for PT students. And I was blown away by the amazing students who applied. We wanted to have 20 applicants. That was for this first round. We actually got 40 applications. And if you go to risingtide.org, you can definitely see all of our amazing scholars and their incredible stories. And I'm so proud of the community that we're starting to build around these initial scholars, mentors who have risen their hand to want to help, large organizations who have raised their hand who want to donate so that we can increase the number of scholarships in the future. It's going to really, I'm really excited about the impact that we're going to have, not only on these students, but hopefully on the industry as a whole.
That's amazing. Congratulations on the program.
Thank you.
Yeah, I think just helping who needs the most. And I'm a Latinx, so I can tell it's hard getting the education. And I validated my diploma here, so it was really hard. It took me a long time. It cost a lot of money. And I know it's not everybody that can do it. It's not everybody that has someone that can help them to do it. And it's a lot of time and effort and money, and it's really hard. So I'm really excited about the program you created, and I think it's amazing and helping these minorities. I am one, so I know it can be really hard.
Well, Mariana, I'm going to have to recruit you as part of our mentor program because you have such amazing students, and you and everything you created, and even just what you're doing now with this podcast. I know that you would be received really, really well by these students. So,
yeah, I mean, especially the ones that are foreign or speak another language. I know how hard it is. And then I decided to start a podcast that is all doing another language, but it's all good. We have to face our challenges and move forward and try to be better every day. So
love it.
So let's transition to our final questions. So what is your favorite resource of information? Any books or specific papers, studies you like in particular?
Well, I'm just going to have to. Unfortunately, I'm gonna just do a shameless plug for the WebPT blog. We have some amazing writers, and who scour all different resources to pull in the most up-to-date, relevant information for our community, our WebPT community. And when I say WebPT community, we know that we have no firewalls behind our WebPT blog. Anyone in the industry can access the information. Every month we have a theme, but any breaking news were one of the first to put out detailed information about it. So I'm going to have to say the webpt.com/blog for my
It
favorite
has
source of information.
every time I research, it always goes to the blog. I was like, yep, they have all the good information. Any other resource you want to mention?
Well, I mean, I have, just on the personal side from a business, or I guess from a business knowledge, from I don't know, just from books that I like to read. And I'm blanking on the name of the author right now. So we're going to skip this question and go to the next one.
You can tell me later. I put on the show notes. Everybody can listen,
There you
read
go.
to the
Yes, I have
sources.
like 3 or 4 that I'll add to the show notes.
Yeah, no problem. And what would be the best advice you give to the clinicians that are starting their careers?
Yeah. So my best advice is that please know that you don't always have to have all of the answers. As you start your career, I think too often we think that we know everything, or we're supposed to know everything after coming out of PT school, and that's just frankly not true. I think you're gonna you need to remember that you're probably gonna learn more in your first 2 to 3 years out of school and actually working directly with patients than you will have done in your during your PT school. um, and so that leads me to sort of the advice is knowing that choosing your sort of first couple of, or your first job, and I know this is super hard to think about because of student debt and so many students just wanting to get one of the highest paying jobs so that they can start to pay down their debt. And by no means, I know that's got to be a personal decision on how you do it, but choosing a job just for the paycheck does not it leads more to burnout than it does to having passion for your industry. And so remembering why you got into this, why you decided to become a physical therapist, and, doing your diligence on that, first job as to the culture of that clinic or practice or hospital. Like what are your expectations? Like really taking your time to make that decision is critically important to, I feel, the future that you're going to have as a physical therapist.
Final question. What personal qualities or abilities are important to be a successful physical therapist?
Well, first and foremost, you are a problem solver. So having that ability to identify the problems and connect those with solutions, I think is one of the biggest qualities and abilities that we need to have. Second is being a great communicator, being able to establish a great rapport and relationship with your patient. We know that piece is so important to the outcome that you're going to have with your plan of care, that relationship that you build. So communications, it starts with communication. And then second, truly being able to translate your medical and clinical knowledge to that patient in a way that they can understand it. And I always used to say, like, they need to be able to translate that and share that with their own family in a way that the rest of their family is going to understand what's going on with them as well. So the communication piece, I think, is something that we really need to work on as providers. It speaks to our inability to really broadcast our value in other arenas as well. But it starts really with that rapport and relationship with the patient. and translating our value to our patients on a daily basis so that they can then go translate that and be a megaphone for us as you as the physical therapist that's treating them, but also for our physical therapy profession as a whole.
Yeah, I think learning how to communicate in a simple and efficient way that the patient can understand is going to help the treatment, the outcome, the patient. And then when they are going to talk about physical therapy, other people around them able to understand. And then we go back to the brand PT problem. So
it comes full circle, Marietta. First, full circle.
yes, full circle. So now we can end our conversation. Heidi, do you have any announcement, anything that you want to tell our audience?
Sure, thanks. Yeah, I talked a lot about the State of Rehab Therapy Industry Report. It is an annual thing that we do every year, and it's that time of year again. And so we are going to kick off the survey on February 1. It's going to be open for about 3 weeks. I think we're ending it on February 22nd. So if you wouldn't mind going to webpt.com/2022-industry survey, and you can find it on our WebPT blog. If you just go to webpt.com, we will have it front and center because we're one of the, with close to 7,000 or 8,000 people that usually respond to the survey, it's one of the biggest sources of data and information with regard to the PT industry as a whole. So please do your part and take the survey to input your information. So webpt.com 2022 industry survey. Thank you.
I'm going to make sure to put the link on the show notes so people can go straight. And I was taking a look at the last year's, and it's a lot of data. It was almost like 50 pages with like compiled data. It was really good, very detailed, a lot of information. So it's really...
Thank you for saying that. And if you do take the survey, that's one of the things that we promise that you actually will then get. It's not like your data goes off into the internet somewhere. You actually get the report back, and our team does an amazing job of putting all of the information together in a beautiful format.
Yeah, and all the different areas that you have about COVID, about salary, about all these type of things, demographics. So it's really interesting. It's a good overview of the whole scenario. Heidi, if anyone wants to contact you or learn more about you, reach out to you, how they can find you?
Yes, you can reach out to me on LinkedIn. Just my first name, last name, Heidi Jannenga. So I'd love to connect.
Awesome. Heidi, thank you so much for your time, for sharing all your knowledge and all your views of the future and all the problems of our profession, and for everything you've been doing to help us grow as a profession. So I really appreciate your time and you being here.
Thank you. Thanks again for the opportunity, and keep up the fantastic work. I love your passion and love the fact that you're promoting so much more about how we can improve the future of physical therapy.